Training is an integral part of one's evolution. Certainly when it comes to practice of medicine and surgery, training is a very vital aspect of the whole evolution of the service provider, the doctor. I think touch and technology go hand in hand. Technology is evolving. Automation, robotics have all become a part of surgical training. And especially in this era of digital media, I think incorporation of both automation, robotics, as well as digital world is very vital in the training scheme, both for learning, training, teaching, auditing, evaluating, and to put that sustained improvement is vital for the best patient care that we have to provide. World is a much smaller place. I think training has become very multi-dimensional. From studying from books to gathering knowledge from internet sources, we moved on to the era of simulators, hardware, mannequins, dry laboratories, simulation stations, wet laboratories, tissue laboratories, animal laboratories, cadaveric stations. And I think what is more important is also the immersion programs where you reach out as an outreach program and in-house bring people in as an in-reach to see how we are doing things and to improvise on them. So I think immersion programs have become very, very, very important. And I think collaborations matter a lot, both loco-regional collaborations, national collaborations, and international collaborations. And I think the key is integration of technology and collaborations is very, very vital for surgical and medical training. Thank you. Colorectal surgery is a fantastic specialty. The specialty which has got a wide reach, scalable, and also where you can make a difference to not only one's life but also quality of life. Think about the problems we face. The colorectal sciences, proctology is widely practiced but unfortunately poorly practiced. Colorectal surgery is widely done but suboptimally done. So I think there's a great potential for potential colorectal trainees to get into this field because there's a touch of diagnostics with colonoscopies, there's a touch of interventions that go with office-based work, and of course advanced work such as cytoreductive surgery, HIPEX, and robotic surgeries are on the forefront. And come a few years, we'll be talking about remote surgeries, telesurgeries, integrating robotics, automation, and distance surgeries. So I think the field is truly exciting, the world of colorectal surgery. Thank you.